Hi, everyone. I'm Dr. Eve Glazier, and welcome back to Medically Speaking. Today is the kickoff of a topic I'm incredibly excited to discuss, a 3-part forum dedicated entirely to women's health after 40-ish. Part 1 is going to focus on perimenopause, a term we hear a lot about but sometimes don't understand exactly. We're going to explore what it means, how it shows up, and especially how language and perspective can radically shape our experience. Part 2 is going to focus on menopause 101, and Part 3 is going to be about later in life sexual health. Joining me today to talk perimenopause are 2 extraordinary UCLA health physicians, Dr. Mya Zapata and Dr. Rajita Patil. Dr. Rajita Patil is a certified menopause expert and the founding director of our very new UCLA Health's comprehensive menopause program, driving national change through clinical innovation, research, and advocacy in women's care. Dr. Mya Zapata, return guest, is a board-certified UCLA Health OB/GYN dedicated to inclusive, patient-centered reproductive care, with a focus on helping people navigate every stage of their health journey with clarity and compassion. Mya and Rajita, I am so thrilled that you're here. Let's just begin with some basics. What is perimenopause? Rajita.
Yeah, so perimenopause, by the strict definition, means that periods are not so regular anymore. So technically, really speaking, it would be that when your regularly time periods are more like off by about 7 days or more, you can be skipping periods. And it kind of ends when you don't have a period for a year. So that's technically what it is. Not everybody can use their period to, tell if they're in perimenopause because you might have had a hysterectomy or you might be on hormone therapy or have an IUD in. You could have had an ablation of the uterine lining. So those things mask that. You're not able to kind of use that. But in generally, for people who have a period, that's the best way to kind of characterize when you're in perimenopause.
Okay, so quick distinction then between perimenopause and menopause is that 12-month cessation or stop of no period.
Yes.
As much as you can tell.
Yes,
okay.
Exactly. So when it's kind of like looking back and saying, oh, I haven't had a period for a whole year, that's when you can say that you're in menopause.
Okay, great. And I think, so much I think is about what to expect, right? And how to empower people with knowledge. I mean, I think what we hear about being so distressing, and of course we'll talk about that, is what can we expect, right, during perimenopause, and the importance of being prepared. So, Mya, can you talk a little bit about what to expect during this perimenopausal period?
I think that the range of things is wide. Great. Some people don't expect anything and have lots of symptoms, and some people are anticipating that it's going to be smooth and easy, and they notice lots of changes. So changes can range from changes in your body that you notice, harder to lose weight in the ways that you did before, and feeling like you have the exact same diet, lifestyle, exercise routine, stress levels, and yet weight has gone up 5 or 10 pounds, and it's hard to lose it in the way that you could have before. Sleep might be changing. Maybe just you feel like you slept, but you wake up and you're just not as rested, or waking up in the middle of the night and having a hard time going to sleep. It could be mood changes, feeling more irritable, feeling if you had mood symptoms before that they're worsened, whether that's ADHD worsening or anxiety or depression worsening. It could be skin changes, feeling like the quality of skin on different parts of your body feels different. What else am I forgetting?
So you just even like hot flashes. So sort of, all of a sudden having waves of heat. I would say that's the most common symptom. Or waking up at night and having sweats and that's really disturbing your sleep. There's like 60 plus symptoms of perimenopause.
Yeah.
And so
go on forever.
Really, and everyone just experiences this journey and this transition very differently.
Right. And layered onto the fact that we're also getting older, right? There's often life stressors that are also happening at these periods as well. But why do these symptoms even happen?
Yeah. So, I think that the biggest thing is that there is a fluctuation of hormone that's occurring because the ovary is no longer kind of doing this predictable dance, I say, of like, this how the hormones go up and down and you ovulate regularly and you have a period every month. And so that predictability is kind of erased. And so it's much more wild and imbalanced in the sense of like it's not that normal kind of balance. It's not that And so some of the symptoms that you feel are because of the fluctuation, and other symptoms are because there's just a drop in the actual estrogen level. And so, for example, mood, definitely we know is due to the fluctuation of the hormone. And it's not something that persists when you get deeper into menopause because the hormones are just more stably low producing.
Things get unpredictable. And I like the dance, so things get things get jazzy.
Yeah, and I think, like, to your point, right, you talk about this stressful time.
Yeah.
I always love to tell people, when I see them in the office, look, you are a super person. You're a super woman. You are juggling enormous responsibilities in the home and in the workplace. And at this time, many people are at the top of their career. They are maybe taking care of kids still, but also maybe taking care of elderly, or they're going through empty nest syndrome.
Yeah.
Or they are still the primary consumers of the home, caretakers of the home. And so they're doing all these things, and they've figured out how to juggle this so nicely. And then all of a sudden, this transition starts to happen where there's the hormonal shift and everything gets rocked. Their equilibrium gets rocked.
I would like to add too that it's happening because it's happening simultaneously. It's not like you get little bubbles or little lists that say, this is happening to you now this is happening to you.
This is a hot flag.
You're so busy with whatever phase of life you are, which, as you just described, is usually with lots of different factors and things that someone is juggling. And then as some of these various symptoms to different degrees for people are happening, it's most people, when we talk to them in clinic, are almost not even aware of the individual thing. It's sort of just wrapped up with, I have a lot going on, I'm just not feeling as awesome. And only when someone stops and reflects and maybe even asks in a very are you having this thing? Is this happening? Well, yeah, I'm so busy. I'm just really stressed out right now. And then as you reflect a little bit, they can pull out, oh, that is different. I am having that too. And I just thought it was because I have so much on my mind.
Yes. And I think that the fact that, asking the right questions, knowing, almost journaling, being these are the changes that are happening. This is how it relates to maybe my period timing, or because sometimes the symptoms don't always happen at perimenopause. They can happen even premenopausally when you're having regular periods. But then right before your period, there is a drop in the hormone. A very substantial drop. And a lot of people are very sensitive to that drop, and they can start to feel the same symptoms that they're feeling during perimenopause. And so just even journaling, when do these symptoms happen? How does it relate to your period? How long has it been going on? That can give a lot of awareness for a person, and also for the person taking care of them, to help kind of delineate what is it? Is it just stress? Or am I just working too hard? Or is there actually something else going on?
I mean, it seems like there's such power in awareness and even comfort in reassurance, naming it, right? Characterizing what's going on. Although it can even be really just difficult to attribute it, right? Perfectly to, oh, this is exactly it. And you're right, it's so complex and layered in. So it sounds like there's all these symptoms. So I guess my question is, and there's the fluctuations in estrogen. Is it true there's estrogen receptors all over our body? Is that why we're feeling it in all of these different organs and systems?
Yes, absolutely. There are estrogen receptors from the vagina to the heart to the brain to the skin. They're literally everywhere.
Omnipotent.
Yes.
That's estrogen.
But what's interesting is that, not everybody experiences all the same things. So definitely matters, genetics matter, your health factors matter, your lifestyle totally matters. You're just basically a lot of things we don't even understand matter. We don't really know everything. And so that's why everybody doesn't experience it the same. And so but definitely the fluctuations affect the organ systems.
I love that humbling statement. We don't know everything.
No.
But I think what I love, especially about the two of you and your approach, is that we just want to talk about it with you. I think what's confusing sometimes, and I'm both of you know I'm a primary care doc, is sometimes because the symptom spectrum can be so wide, let's say I have a patient who comes in and she said, oh my God, all of a sudden my period is 8 days long, but I went to see a doctor or I talked to a friend and they were like, oh, it's just perimenopause. So it just kind of gets basketed. Yeah. So, but when is it important to say something?
Yeah.
Or when to be worried? I mean, I always like to tell people, if you feel worried, talk about it. But what do you think?
I mean, I would agree. I think that it depends on how it's affecting someone's life and making sure that the symptoms that person is experiencing aren't so outside of normal that we need to be concerned. Like you gave the example of bleeding. And if your period one time lasted 8 days instead of 7 days, it's a change and maybe they're aware of that. but that one time isn't worrisome. But if it's lasting for 10 days and now starting to last longer and longer, as their gynecologist, their main gynecologist, I might say, let's work up this bleeding. This is probably related to perimenopause, but we need to make sure that there's not something else going on. Sometimes someone will say, it used to be 5 days and now it's 7 days. And maybe I'm not concerned, but like you said, they're concerned. And so I want to understand what's different for them, what else are they noticing, and what do I need to do to reassure them as well. Even if I feel like it's fine. Sometimes the patient needs to be reassured.
Absolutely. I definitely think like listening to the patient and how much is it bothering, what is going on with them? Like we want them to live their best life, right? So as it is right now, as it is in the future, as it will be in the future. But I think that we want to, if it's bothersome to them, it doesn't have to be severe, right? It does that this labeling of like, oh, it has to be severe to do something about it. No, I mean if it's affecting their daily functioning, their sleep, that's something that we should be listening to and trying to help figure out how to improve their quality of life. And I think it also goes to state that like there's these labels of, sort of premenopause, perimenopause, menopause. I mean, I know sometimes patients get very fixated on, and even doctors and providers get fixated on, where are you in the spectrum of this process? I mean, in some ways it matters, but in a lot of ways it doesn't, right? It really matters like how are they feeling? How are you feeling? That is what we really want to address. And so it's really important for you as a person to really understand what the changes are that are happening and advocate for yourself and journal and talk to your provider about it.
I think you say something really important. That is, it's not really that clear. Yeah. And we, as people, humans, like things, many of us like it to be really clear
compartments, yes.
Very, like, yes, wrapped up. This is exactly what's happening right now. And most of the time you can't quite define or say how long or give it a nice label. It is sort of this basket of terms. And so I think helping patients feel okay with that we don't have to know exactly, there's not a level necessarily to check or something specific to do at this moment. We'll observe, let's pay attention. That doesn't always feel very neat, and that can be hard.
I think as long as you know that it's not neat, that already, alleviates, right? I think stress. I mean, and even if something is normal, I mean, let's just say that, let's go back to the bleeding example. There might be things to alleviate the symptoms, though, of heavy bleeding, for example, correct? I mean, if you're really bleeding 8 or 9 days and you're bleeding a lot, you could possibly become anemic, right? Like, so low blood levels. And that will then have its own, right, constellation of symptoms of feeling low energy or headaches or shortness of breath. So I'm loving what you're both saying is just what's the personal experience. No one should tell you what matters to you, right? You decide if something is debilitating or disruptive. And it sounds like there's things that we can do about it if we want. Any thoughts kind of about just some symptom alleviation? I mean, we'll talk about that more with menopause, but even during this, again, just sort of perimenopausal period, what are we talking to patients about?
Well, I think definitely lifestyle is a huge, kind of topic that I bring up in every discussion because yes, sure, there are medical treatments and we can definitely go into all of those, but I definitely think there's power within the person. And I think that one of the things I always kind of say to people is, look, estrogen has been sort of protecting you, giving you this little added buffer, like, oh, okay, for example, like maybe you went out and drank a few drinks and you still slept okay that night, but now it's not working so well. Well, part of that is you're just more sensitive. Your body is more sensitive to stress. Your sleep disruption is going to be easier to have. So I think understanding that going into things with a little bit more intention. So what you put in your body, how you sleep, your sleep regime, your stress reduction practices, your exercise, how you socially connect with people, just those things, the way we live our life, I think it matters so much more during this time. And I think that's empowering, like that you can do something about that you have power in the process.
You're more than a hormone.
Yes, you're more than a hormone.
And so that protection, that buffer, like now actually the new sword and shield are you.
Yeah, but I think that's what makes sometimes people feel like something's broken is that I did something that worked for the last decade sometimes. Yes. Like I had a routine down. I had an exercise routine. I figured out my life and my family or my work. And so why isn't that working now? Something must be broken because I knew how to manage this body and now that's not working.
Yeah.
speaking of that, exactly. So exactly the fixing. I still want to get away from we're broken, we need to be fixed. And so I'm always so struck by the language that we use in medicine and why words matter and how framing is so critical to the narrative, our narrative. So I would love to talk to you guys about those terms like ovarian failure and even just hormonal imbalance or deficits. It just seems like a lot of the words that are out there so far, the patriarchy, is that kind of frame this change, this evolution, as a pretty negative decline, right? There's always like this decline instead of a transition, right? Or even an evolution. Your thoughts?
Yeah, I mean, I think that, like, I know there's so many that, I mean, so much to say. Yeah, I mean, I think this idea of medicalization of the process, it is a process that every person with an ovary is going to go through. It is not a pathology. So
every
person,
woman will have this, or female body.
You're lucky.
This.
Yes, if you're lucky. And I think of it, that's actually a great term because it isn't. So I think a lot of people equate this with, first of all, they equate it with aging, which is like a whole other, it's completely different from aging, right? Like it is reproductive change in the sense that the ovary no longer is not active. But that doesn't mean that your whole body is just aging exponentially at a moment in time. That process happens for both sexes gradually.
Yes.
Right? But also that this is a normal process and that it doesn't mean you're any less for it. Personally, I think it is like almost like a rebirth, like a celebration, because you are free of a lot of things. You are free of contraception needs. You are free of worrying sometimes about like little children that you have to kind of rear. At this point, a lot of times the children are older, and you're like you have a more a freedom that comes along with that.
Concern about pregnancy. People have spent decades. Yeah. I don't want you pregnant. I'm trying not to get pregnant when I don't want to, and then all of a sudden, being like, I don't have to.
Oh, I'm not like.
And periods, like not having to deal with, hygiene products all the time or like unpredictability around that. I mean, there's so much freedom. And to be honest, like the society, we really need to start celebrating it.
Yes.
And kind of elevating people. And you know how there's quinceañeras and there's mitzvahs and there's a summary of
conditions, celebrating of transition.
So why are we not doing
all parties?
Yes. Why are we not doing that
menopause rave?
Yeah.
But also then that reminds me though, like, why aren't we talking about this during health class in ninth grade? By the way, for everyone, boys, girls, everyone, because we should all know this. Like this information shouldn't be siloed the same way we all learn about each other's puberties. We should learn about each other's changes. We even had Dr. Chris Seigel on from urology talking about andropause and, changes in the male body over time. But I mean, this is why, this conversation is not just for women. This is for everyone.
Well, did you know that in the sexual reproductive health term, menopause is not even included? So there's definitely some issues around them in the medical system itself too, right? Like, and it percolates all the way down. Like high school students, they learn about puberty. In junior high, they learn about puberty, but they're not learning about the other bookend of sort of the reproductive lifespan and what's going to happen.
Right.
And that education starts there, but like it's not even included in that full term. And I think that's a problem. And I think that's something that we need to kind of work towards changing so that it's inclusive.
And not putting the value of a female body as just the reproductive potential to breed or to have this potential for having a baby or having a pregnancy or looking a certain way, that it puts value on a female's body just because it is for their whole reproductive lifespan.
And 40% of the life is lived in the menopause timeframe up to. So that's a long part of our lives, right? That are lived in this time where we haven't valued it.
And they should matter. They do matter.
Yeah. It's such an opportunity. I mean, I think that, but like you say, it's not just like the media, right? Who's kind of this treadmill of perpetual youth. It's also medicine. It's our medical system. And even again, like the language, I had a patient, who was, asked me to take off her diagnosis list. It's a code, right? So it means it's acknowledged by insurance companies, vaginal or vulvar atrophy, atrophy meaning,
the term. Yeah. Atrophy is shriveled up and gone away.
Right. Shriveled up and gone away. Yeah, exactly. I love that you're saying celebration. I mean, I feel that way. I couldn't be more excited about and feel more fortunate about getting older and not being defined, right, by estrogen or reproduction.
it's kind of like a rebirth for a person too, right? Like you can do so, it's a time to focus back on yourself too. And probably most people taking care of a lot of things. Well, now we get to focus on ourselves. And I think that's exciting.
And in fact, your body demands it. It demands it. And to be able to be liberated to make the space to do that, because your body does demand it. It demands a little bit more exercise, a little bit more sleep, these things to care for this whole thing, make it continue to function well, and taking that space in your life to do that. I think that's pretty important.
I love talking to the two of you because I just feel excited about it. With how they, by the way, which is how kids should feel knowing about this. By the way, no matter who you are, how old you're.
Yeah, it's not something that's bad or that is something to run away from. Even patients will use the language sometimes where maybe they don't love their period, but they're like mourning the loss of seeing blood or having a period each month because that means that something bad is happening or that they've lost something. And
they feel a loss of sort of feminism, youth. There's a lot of this aging kind of feeling that people get when they I feel
we've been conditioned.
I think we get that. It's like, oh, what's your purpose after you can't have children anymore? And I think that's where the reframing in society has to happen, right? And other cultures do this. It's just not been done in this country very well. I think we're starting to, have a moment here, and the awareness is really happening. And I think that's the first step is we got to start talking. We got to start feeling comfortable with just talking about it and not being ashamed. Right?
Yeah. I want to bring up, though, that part of what makes it feel negative is that people don't always feel good. So something that is normal doesn't always feel pleasant. So yes, we said the words, this is a normal process.
Yes.
But and it varies from person to person. Some people had not one symptom, the period went away, and then maybe they had one hot flash or two, and then it was over. And that was easy for them. And other people suffer for years with symptoms, sleep changes, hot flashes, just not feeling like themselves. And it's not pleasant. So if I tell them, what you're going through is normal, and they want to punch you in the face because you're like, well, thanks.
Yes.
I feel terrible. That's where you can do things to maybe help them feel better. But without that, of course, someone might have a really negative feeling about this transition in their life. They feel terrible. How are you able to celebrate when you're like, I feel not like myself
and exhausted?
I don't feel well. Right. It's hard to celebrate that.
Yeah, absolutely. I definitely think not everybody's going to feel great going through this. And that is why, and they have been silently suffering, and I think people weren't talking about it, doctors weren't educated about it. And so I think that there is a way to get through this period of time, which is not forever, where you have these feelings, these symptoms, and you don't have to suffer.
You can be validated.
You
can be supported. And even if it doesn't mean a certain medication, but just efforts and being seen that this is what you're going through and how can we help you through that transition, that's a different experience than feeling like you're crazy or that you're making it up or that you're dramatizing it.
My gosh, dramatizing. You're so hysterical. I always like to remind people, also speaking of language, right, that the ancient Greek, right, word for uterus, right, hystericus, like wandering uterus. Hysterical means wandering uterus. Talk about punching in the face.
Yes.
Anyways, let's talk about how we do make people. So I think there's also, I think it's wonderful, right? There's a lot of more awareness. I think luckily, hopefully a moment will turn into a norm, right? And just a convention of just of talking, educating, discussing. I think we'll talk about this also when we talk about menopause, but let's talk about it here. I mean, so for symptom alleviation, right? I certainly have patients who are like, I don't want to do anything. Is that okay? So I want to reassure them. But for people who do want to do something, right, before they're actually in menopause, so before there's been 12 months without any period, as we know, what are you advising? So we talked about lifestyle.
Yeah.
But just, I guess, medically or,
Yeah, there's so much out there now.
Yeah.
So I think it depends on the symptoms.
Yeah.
But we have hormonal therapies that work very well. And we also have a lot of non-hormonal options, a lot. And there's more and more coming for these exact symptoms. And so it's hard to tell, there's not like one magic treatment, but there's a lot of options out there. And some of them are medications and some of them can be even therapies like cognitive behavioral therapy or using acupuncture, acupressure, using some supplements. There's a lot of different ways that we can be using Western and Eastern medications and I guess techniques to really synergize along with lifestyle. And so it's not just one thing. Yeah.
Holistic approach.
Holistic. It has to do the whole
You gotta get that ruling it, and it really is there is not just a one silver bullet, as you mentioned. Even if someone does, for example, use hormones, which do address a lot of things for a lot of people, it's still not necessarily addressing everything. And so one might still need to do these other modalities and these other things to holistically approach what's affecting their life.
Actually, to that point, right? Like I always tell patients, look, the reason why you feel these things are because estrogen is fluctuating and estrogen is declining. However, giving back bioidentical estrogen, looking exactly the same, but still made from a plant, bioidentical, doesn't fix everything.
Yes.
It will help a lot of the symptoms, but it doesn't fix everything, right? It doesn't build muscle. It doesn't, make your skin magically the same.
You're not going to feel fruity.
Right.
And you're describing creating a realistic expectation.
Yeah.
Expectations. We haven't really done that so well in medicine and healthcare for lots of things, especially this transition. It sometimes seems like if I take this medicine that you gave me, it's just going to be magic and I'm going to wake up and feel like my old self the next day. And sometimes people describe that, but that's not necessarily everyone.
Right.
So I think realizing what factors are also important and that you might have to address.
And being comfortable with changing. But you're reminding me too, right? I mean, we're talking about a time period, perimenopause. I mean, maybe starts around what age? Ish.
I mean, the average is about 45 to 50, but, some people go through it as early as in their 30s. Some people go through as late as their 50, mid-50s.
So it could be a 10-year, right, change. And also then your symptoms might change as well. So some therapies, right, I'm guessing might work for certain symptoms at certain points of time. But that's why it's so important to have this ongoing dialogue, right, and conversation with your provider, because then later it could be sleep, right, or anxiety or brain fogginess. So I'm guessing, it's about having that constant evaluation and review.
Yeah, it's really important to kind of, first of all, gather the information from the person as to like, what are all the different things that you're feeling? And sort of assessing all the different parts of their whole body, their whole person as they are now. Also, I will just mention that we are wanting them to feel better, but we do also know that there are some potential increased risks that do occur when we lose that estrogen for some people for different chronic conditions. And so we want to be evaluating for that and kind of knowing, hey, what is their genetics? What are the genetic factors? What are their lifestyle factors? What are their health factors that are unique to them that we want to address at those times? And we need to keep addressing them every year. I mean, it's not something that we don't just like give hormone therapy and say, oh,
then you're going to go off.
Yeah. Right. All right. No, because first of all, we all know hormone therapy has some risk. And those risks change, right? It's not static.
Yes, exactly. Because we're not static.
We're not static.
Can you break down a little bit of what those risks are?
Yeah. So for most people, right, when they're using hormone therapy in the early parts of menopause, perimenopause, and for the average risk patient who doesn't have a high risk for breast cancer, in general, we say, for breast cancer, the risk actually is pretty much not increased for the first 5 years of using it. Now, age increases risk of breast cancer. And then after we get to about the 4 or 5 years of use and beyond, that's when we start to see a little bit of rise in breast cancer risk. And that, of course, just increases with years, mostly because of age as well. Now, for blood clots, a little bit different. That risk is immediate, but it's a very low risk, 1 in 1,000. So 1 out of every 1,000 people will get a blood clot. Now, blood clots are scary, and they definitely can be lethal. It's, but so it's not something we don't want to be not talking about. But it is low risk when you think about it.
Sure. Wait, so there's 1 in 1,000 for replacement
for menopause hormone therapy
compared to, I'm just curious if you know, for birth control, oral contraceptives, what's the risk?
It's under one. It's probably about the same, but it's
okay. Good.
No, so under 1%.
So very low. Yeah, and I think
definitely
okay. I was wondering.
A higher,
and that's a higher rate. That's I was asking.
However, younger.
Yes, but younger person. Yeah, right.
Maybe less medical conditions.
Yeah. So a lot of it is entangled just and also just getting older.
But I will say that for most people who don't have established cardiac heart disease or cardiac disease, who don't have an elevated risk for breast cancer or don't have breast cancer, who don't have a risk for blood clots, in general, it is considered pretty safe.
Yes.
And so I think that was something that people were not very comfortable with before. And I know, in the early 1900s, 1960s, 1940s, these were just, given out like candy. And then, right, we had 9/11 of sort of hormone therapy, which was the WHI study, which we learned a lot from, but definitely not the right type of study to kind of tell us about the risks of hormone therapy in younger people. And so the pendulum swung the complete other way. And
now it's scared.
Yeah, everybody was so scared.
So healthcare providers were scared.
You didn't hear anything about it.
We would just taught don't really use them unless it's like absolutely necessary. We just got scared, and then that got perpetuated. And so, yes, there are, like you described, some risks, but numbers are hard when you're the person making the choice. You're the patient. Numbers 1 in 1,000, 1 in 500. Like, how do you really conceptualize for yourself? And so sometimes trying to help a person make a choice really it's about risk benefit for them individually. If my symptoms and my quality of life is such that is it small, medium, large, the risk, extra small? Like, it's not even just the number, but if it's an extra small risk, or at least a very small risk, and my impact on my life is extra large because I can't sleep, I don't feel like myself, I want to punch people in the face sometimes. How do I make that choice? Maybe that feels more worth it for them. But to somebody else who really hasn't noticed much difference, when you say any number of risk, even if it's extra small, they might say, oh, well, that doesn't feel comfortable to me. Maybe they don't have any symptoms that are that bothersome. And that's their own algorithm, their own math.
Yeah, and we can't create that formula. And I think the values and the preferences of a person is really ultimately that shared decision making that needs to happen at every single visit. We can give guided recommendations. However, I have plenty of patients who are high risk for breast cancer that, they hear me, they hear the risk. We have to give them the good information, right?
Yeah.
We want to give them good information so they can make their own decisions because they are their own person and they have the power to do that, to tell us what they want to do. And we have to support them. And so I don't think it's right for us to say, you know what, you are not a candidate for hormone therapy because you have breast cancer. I mean, we can say, look, the risks are higher for recurrence. There are other alternative options. Here are the options. But, there are some things that are beneficial specifically to hormone therapy that some of these other options may not tackle all of those things. And they will weigh those things and decide. And we are here to support them. That is all our job is.
We make the recommendations.
Yes.
Patient makes choices.
It's so incredible and inspiring and refreshing, though, to hear you center the patient and the individual into the calculus of this decision. And again, reminding, it's not static. Like, we can have this conversation now. In a year, you might change your mind. 6 months. Let's just keep having the dialogue.
And your health might change. Yeah. Who knows?
Yeah.
What's going to change?
Your perspectives. Yeah.
Yeah, totally.
I'm really also just interested because I just feel, if I feel lucky speaking with the two of you, I can't imagine how lucky your patients feel. So I am interested, in sort of luck and accident of birth and access to this incredible information, not, let alone approach, how it impacts health outcomes, how it affects just how we approach our own health. I'm curious kind of when it comes to, perimenopause and menopause, how does access to information and also misinformation affect a woman's experience throughout this? How can we kind of address this and make sure that we're as inclusive and as possible in getting this information out, especially good information?
Well, you're doing a great job right here.
Yeah.
I would say kudos to that. I mean, I think that it is such a tough time actually because there's so much information out there. And, there are celebrity doctors out there. There are celebrities out there. And they're doing a great job at helping to promote public awareness. You don't need to silently suffer. Your health matters. These are really key. This is key. But there's a lot of other things around misinformation that, patients are trying to figure out, well, what do I read? Is this the right book to read? Is this the right, Instagram to follow? Is this the right information online to be looking at? And so I don't have a great solution for that because the problem, but I think we're moving towards good stuff. I think right now we have this exponential demand for care, which I think is amazing. And it's like, gosh, menopause is not new, but somehow it sort of feels new, but it's not new, right? And now it's really coming to a forefront where people are like, I'm not suffering anymore. I demand good care. And that's great.
It's excellent.
Problem is that we have a sort of a supply-demand mismatch in the sense that we, as the medical providers, have gone through training. I received one lecture on menopause.
Same.
And
even current training,
OBGYN
residents that are going to be your future OBGYN doctors that you'll go to, they get very little training about menopause. So even they may be well-intentioned, ready to hear and listen and validate, but might not have much experience or knowledge to be able to share. So we're trying to change that.
Gen X, we're counting on you.
Yes.
For a lot of things.
Yes, we definitely have to work to change the medical curriculum.
Yes.
So, okay, there's one approach is let's work from the bottom up and like make sure the next gen has all the right information, not fearful of hormone therapy, not fearful of
OBGYNs.
and not all OBGYNs.
Doctors, right? Primary doctors, family medicine doctors who are caring for women.
Absolutely. I mean, there was actually a study out of Mayo in 2019 that surveyed all the residents coming out of like primary care and OBGYN, and you would not believe what do you think the percent is of providers coming out saying, I'm ready to tackle menopause and care for menopause patients?
0.2.
Okay. It was like 8%.
Oh my
It's
God.
pretty sad. It was really sad. And there's an updated version of this, and I think it's like 20-something%, something like that. So, look, that is one big thing we need to work on, and but that's going to take time.
It should be as ubiquitous as high blood pressure.
Yes.
Hypertension.
Yes,
right? When you experience it yourself, either that's maybe being having birth. You are more of an expert in having a birth.
That's right.
If you go through perimenopause, menopause, you are more of an expert. Maybe you care more. That might even be what brought me to care more about it as a doctor.
Yeah.
But you don't have to have experienced something to be able to care for a person in it. Like you can take care of a person who has different medical conditions, autoimmune disorders, and never have experienced them and still be a good doctor.
Yeah.
So we can change our curriculum so that you don't have to have experienced it to then be motivated to care about your patient's experience.
Absolutely.
I think the second issue is that in order to meet this demand, we have to work to educate the current workforce as it exists today. Right now, it really takes a doctor's time and dime to go learn about this. And so that is a problem, right? Like, so we have to start to educate all of the people who are getting this extra training, who are going and using their dime and time. Our job is to now help get everybody else up to speed because our patients deserve that. And they do need to have good information and we want evidence-based practice, right? So we as an institution, it's our job to work towards these things so that the good information gets out there, and that other institutions are doing the same thing, so that's what's really superseding the kind of things that people are hearing about, online. And so it is hard right now. I don't think I can kind of wrap that. I think that it's going to take some time, but it is going to change.
And we have to have continued dialogue with our patients. Nobody lives in a bubble. People are on the internet, on TikTok, on Instagram. They're reading books that some are great, some are maybe not as good. So have a dialogue and ask, well, what information have you been looking at so we can talk about it and not pretend like you are the end-all be-all of information to download to your patient. They're going to get information from everywhere. Let's talk about it. Let's help debunk some myths that maybe you heard. And maybe let me clarify that for you a little bit. So that dialogue and relationship has to change in healthcare with healthcare providers.
And, we're talking about our medical colleagues, but I mean, this is the opportunity too. And this kind of goes to the reframing, right? Or just kind of owning and then perpetuating a narrative, right? I mean, the power of stories, telling each other stories. I mean, I only remember things if someone's telling me a story, right? But there's also like our conversations between friends, right? Family members. So the more information that we get out and then share, right? Then we can talk to each other. We can educate each other once we have that great information.
I know people like to share, especially women. They love to talk.
But then you listen.
Yeah, and then we listen.
You listen in a different way often.
But sometimes you need permission to share. Yeah, it's okay that it's not something that you need to sort of quietly hide because no one else is experiencing it or maybe no one else is having your experience. Permission that it's something okay to talk about and to maybe share your experience, validate each other.
Mm-hmm. And again, it doesn't have to be this like proverbial kitchen wisdom, right? So I mean, do your patients ever come in with their partners, spouses, friends? I mean, what can we tell partners, families, again, our kids, to how to support, us?
I will tell you that it's pretty uncommon that a partner comes in. I love it when they do.
Yeah.
And I thank them for being there because I said, you are going to learn a lot and you're going to be able to help support the person you care about. You're obviously here because you care so much about this person who's not doing well for whatever reason or wants you to understand what's going on. So I thank them. And I wish that more times that people would bring their friends, their partners, their support so that they know how to help them. And, going back to your point about like community and really having power and sort of sharing, we did this whole, it's called Centering Menopause. And it was really this idea of bringing a cohort of 10 people who are going through perimenopause, menopause together and just talking week by week with specialists and us with each other about their experiences and talking about different topics. And it was so empowering for them. It was powerful for me.
This was not just like we brought a group of friends in who already knew each other. We brought 10 people together who had never met each other before. And by the end of their 10 visits, they were really medical visits, but that were curated and edited to really educate them and allow them to share. And by the end of the 10 sessions, like they were so comfortable. The things that they shared in a very safe, supported space and were able to validate each other, learn from one another's experience it was amazing.
It's nothing that we could do in a medical visit.
Is that amazing? And I'm sure the retention is so high.
We did a little talking. Yes. Majority of the time, the patients were doing the talking. The experts would come to share a little bit of information about their particular expertise and topic.
Yeah.
But a lot of the talking was from the patients and their reflections or their questions were amazing.
I mean, it's just, this is what I feel so passionate about. Education shouldn't be this privilege, right? Like we should all be able to be experts about our own bodies. Okay, we're going to move to one of my favorite segments, Asking for a Friend. Sometimes I don't even see these questions before. So here's one, which is, I hate my husband and I'm rethinking every choice I've made. Is this a midlife crisis, an awakening perimenopause, or all three?
I mean, that's a loaded question.
I know.
There's a lot there.
Yeah.
I mean, I definitely think, I think we really have to understand, there could be situations around that, right, that have nothing to do with maybe the hormonal changes that might be happening.
Yes.
But yes, there may be an element of hormone change that is happening.
Right.
Because a lot of times it comes down to how they're responding and reacting, their mood and their stability of their mood a lot of times, and sort of their coping mechanisms that are no longer kind of the same. And that happens because the neurotransmitters in the brain are actually somewhat destabilized when these fluctuations of hormones are going on. So number one, it's like, okay, making sure it's not other factors, but if that's the case, look, this is why it's happening. You're not feeling as stable because of this. The good thing is this is a little blip. It's not going to be like this forever. It is going to go away. Your hormones are actually going to be stable in menopause later, but during this time frame, you don't have to suffer, and that there's ways that we can kind of stabilize these neurotransmitters. Some of that could be through therapy. Some of it can be through medication. And honestly, just to know that there's something that they can do and that they're not going crazy and that they're not having a midlife crisis. It is actually, there's a reason for why suddenly there's been a shift.
I would say holistic approach again, because this, as we've described, this phase in someone's life is often a time of great transitions in one's career, transitions in their family life, as you described, in your home. Are children getting older? Are they leaving? Or is your job changing? Or your stressors changing? So all of those factors might make you all of a sudden feel like this relationship that perhaps worked before isn't working as well. And yes, hormones might make that person feel like they can cope in the way they were able to cope previously, but still that same holistic approach. What's happening in my life? What are these feelings that are happening and going on in me? Reflecting, paying attention, other approaches to work on stressors and just understand what's happening.
Yeah. And even bringing that. Yeah, I was just going to say communicating with the partner.
Yeah. Like you're communicating with us, the providers now, and thank you for this question, and also communicate with your partners and your family. But you're not crazy.
No. Not crazy.
And you're not going crazy.
No.
I love saying to my patients, when I'm acknowledging that they're suffering, I know you can feel better.
Yeah.
It's just, that's like the one thing was one of my favorite things to feel as a doctor, is that I know you can feel better.
Absolutely. Yeah. And I think that there's power in knowing that this is not a permanent, there's nothing wrong with you. Like you didn't do anything wrong.
Yeah. You didn't do anything wrong and there's nothing wrong
No,
with
the
you.
rules changed in your body.
Yeah. And you're not broken.
Yeah, you're not broken. So now it's like just trying to figure out, okay, what does my body need now? How can I still optimize how my body's working? So less of like fixing, but more just optimizing as your body's changing, hormones are changing, life is changing.
Yeah.
How do you optimize?
How do we optimize your mood? How do we optimize your sleep? Let's make sure we're knowing what we're putting in our diet, what we're putting in our bodies.
Yeah.
You know, what are we doing to make ourselves feel good? What are the things that make us feel good, actually, right? Like
Sometimes
maybe
people don't. You have to actually stop and really reflect. Sometimes people haven't had a chance to know that.
Yeah. And you should be constantly interrogating yourself, right? That's not a static question. Okay, before we go, and then before we move on to part 2 and 3 of this amazing series, any just takeaways, though, around perimenopause, just from either of you? Things you really just want our listeners to take away? I mean, there's been nothing but gold kernels of this entire conversation, but anything that kind of sticks out on you that you'd want people to remember?
Know that, number one, if you feel like your body's changing, if you feel like you're changing, something's not feeling balanced for yourself right now, definitely start to journal, start to think about what's happening so you have even more data to think about and also bring up with your doctor. Don't suffer. Don't need to suffer. But also just like, I really think for me, it's like this idea that we can celebrate this new transition. It may not feel like a celebration at this moment, but like it can be an opportunity to focus on yourself when you maybe have just been focusing on a lot of other things. And now we can just say, you know what? My body needs this. I want this. I want to focus on myself and do the things that are going to make me feel good. And so it's just like an opportunity, a growth, a celebration.
Okay.
I agree 100% with that. Like just having a different perspective that can be a little bit more positive and really gratitude for if you're at this point in life, your body has worked really hard for you for a very long time in lots of different ways. And so being grateful that you're even in this phase and grateful to your body for supporting you all these years, and you're going to keep taking care of it.
Ugh, you guys are the best. I thank you from the bottom of my heart for being here today. Thank you for kicking off this forum with such wisdom, such warmth. These same amazing doctors will be joining us for part 2 and part 3 for Menopause 101. Everything you need to know and more, and sexual health after 40-ish. And for our listeners, you've heard these amazing, amazing physicians and people. So let's keep these conversations going. Let's reframe, let's break stigmas, and let's empower each other with, I think, so much knowledge and compassion. Also, let's be intentional about our language. And we'll see you next time. Thank you, guys.
Thank you.